week. Now, even if you're vaccinated, you might wonder anytime you have a runny nose or a sore throat, is this COVID or something else like a cold or allergies? And at what point should you actually go and get that test? Shannon Miller spoke with Connecticut healthcare leaders about this very subject.
In all honesty, I wouldn't even try to decipher between the two.
Is it just a cold or COVID? Dr. Ulysses Wu, System Director of Infectious Diseases and Chief Epidemiologist for Hartford HealthCare, says now is not the time to self-diagnose.
If you are experiencing any symptoms, whether you are vaccinated or not vaccinated, the suggestion would be to test.
Wu says while some respiratory illnesses like colds, influenza, RSV, and human metapneumovirus may mimic COVID symptoms, there are some distinct symptoms to consider.
And that is the loss of sense of taste, the loss of sense of smell. If you are experiencing high fevers and a cough and shortness of breath, probably more likely to be COVID.
We're hearing from a lot of people who are seeking testing.
Leslie Gianelli with the Community Health Center says its locations are seeing more calls for COVID testing, both from existing and not patients. It's been just 1 month since CHC closed all 20 of its mobile drive-through testing sites in the state. Locations like Pratt Whitney Runway and East Hartford keeping some of the equipment close by, just in case.
We have had a testing infrastructure. We're eager to go back and help with the testing throughout the state as well. As soon as the state needs us, we're ready.
Whether we see the return of mass testing sites or not, Wu says now is just as important as before to test for COVID, even if you think it could just be a cold.
If you love the ones that are around you, it probably should be the best thing to do.